This is Health Matters, a podcast from Mayo Clinic, where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about bunions and foot care. According to one survey, 44% of Americans said they were self-conscious about how their feet looked. So it's no surprise that having a bony bump like a bunion can cause people not only physical discomfort, but also emotional discomfort. But what can you do about it? Some people say we're wearing the wrong shoes, others that we shouldn't be wearing shoes at all. But it's time for those folks to step aside because we're talking with Dr. Martin Ellman. He's a podiatrist at Mayo Clinic in Rochester, Minnesota. He's going to help us get to the bottom of what to do about bunions and help settle those debates about what our feet really need. Dr. Ellman, welcome to the show.
Thank you very much for having me.
I was going to start off by saying we're going to keep you on your toes with this interview, but we're actually not going to. We're going to cover all sorts of things that you already know by heart. And I have promised myself I am going to keep foot puns to a minimum. So let's just start off with the basic. What are bunions?
A bunion is a deformity in the forefoot region. So the foot is divided into three sections. There's the hind foot, which is the back of the foot, the midfoot, which is the middle part, and then the forefoot. And the forefoot is made up of bones called metatarsals. There's 5 of them. They're long bones, and they attach to the toes. What happens, for various reasons, that first metatarsal shifts toward the midline of the body. But because of the tendon attachments to the toe gets tethered outward away from the body. So when one develops a bunion deformity, it's not a growth. Most people say, I've got a growth that's developed on my foot. So it looks like the foot has widened, and it actually has widened, but it's not a growth. It's just a shifting of the bones in the front part of the foot.
And then it thus makes a lot of people think, is it because of the shape of a person's shoes that they're wearing? Is that because women in particular might be wearing pointy-toed shoes? But what can you tell us is the truth about bunions?
There's a whole variety of reasons for bunion deformities to develop. Hereditary factors can be one cause. I've got a nephew that's got cerebral palsy and a muscle imbalance, and he's developed a bunion deformity. Inflammatory disease, such as rheumatoid arthritis, where those ligaments that hold the bones straight may start to weaken, and that toe starts to drift out because of that. And then we think of external factors, even shoe gear, can play a part in the development of bunion deformities, particularly if there's many, many years of wearing shoes that are narrow-toed or high-heeled, where that foot is being confined and compressed into a small area. And that's not everybody, because there are patients that I've seen that have worn heels for years and years and years, and their feet are fine. We don't want to put a blanket statement saying that because you wore these shoes, you're going to get a bunion deformity.
Mm-hmm. For people who may see bunions developing and do wear those types of shoes, is it because the shoe is shaping the foot into that position, or is it because the muscles are being weakened in the foot by that type of shoe?
I think it's more that the foot is being placed in that shape of the shoe, where it's a little wider in the front part of the foot and then just narrows down. So you're squeezing those toes together. And over time, that can tend to stretch out those ligaments.
And why do bunions tend to affect women or people assigned female at birth more often than men? Is that because women from an early age, we are encouraged to wear these very uncomfortable shoes? Or is it more of a genetic sort of thing that women are just more predisposed regardless of what shoes we wear?
It's interesting to note that women are 3 times more likely than men to have bunion deformities.
Wow, that's a major discrepancy there.
There's not a lot of specific answers in the literature, but there are some considerations. It's thought that women's ligaments may be a little more lax or a little more flexible. We look at the hereditary factors, And then we look at the shoes.
I'm curious if somebody out there is experiencing foot pain, how do they even know if it's a bunion or if it's something else that's going on?
Well, when you start to develop pain around that big toe, we call it the first metatarsophalangeal joint. One of the things that you might start noticing is a little bit of a difference in the positioning of that bone. And so you might actually see prominence starting to develop there. There can be pain involved with that as well. Now, the pain could be external. In other words, it might be from pressure from shoes pressing on that bunion region, or it might be internal, meaning that there might be some arthritis developing in that joint that may be causing pain when that joint moves. And so when we see some of these things happening, it's reasonable to consider being seen by podiatrist or orthopedist that may specialize in foot deformities.
And are there other conditions where someone might think, oh, I'm wondering if this is bunions, but then they'll come to you and it'll be something else entirely?
Yes. So in patients that develop arthritis in the big toe joint, you can get some spur formation starting to develop. That's a little bony prominence or a little bony growth, and that's on the top of the big toe joint. So it's not on the side of the foot. So we do see arthritis, or what we call hallux, meaning big toe rigidus, as one of the more common types of problems around that big toe joint. But bunion deformities are more common.
A bunion is a deformity that occurs in the front part of your foot along the side of the big toe. And no, it's not a growth, even if it might look like one. The bone itself is actually shifting outwards. Some people are more naturally prone to bunions, especially people assigned female at birth. And for those people, shoes that compress the foot might cause the bunion to progress. However, some people can wear high heels all their life and never experience bunions. So it really comes down to each person's unique mixture of genetics and lifestyle. But if you've just noticed a bump on your foot for the first time, don't freak out. Let's talk about treatments, including whether treatment is necessary at all. So now that we have the explainers out of the way about bunions, who gets them, let's talk about treating them. First of all, do all bunions need treatment?
No. In fact, I tell the vast majority of my patients, if it's not broke, don't fix it. In other words, there can be a bunion deformity present, but not all bunions are painful. In fact, I've seen patients that have had bunions for years and years and do fine without any intervention.
So it's not causing any discomfort. It's not causing difficulty with mobility or anything. You don't necessarily need to do anything about this then.
Yep. Now, there's some caveats to that, of course. We have to look at what is going on with the foot structure itself. For example, if we are looking at patients that have more of a flat foot structure or what we call a hyperpronated foot structure, where it looks like the feet are collapsing in towards the midline of the body. With that type of foot structure, the joints may become a little more loose and that bunion might develop. And oftentimes that goes along with flat feet too. We have to look at whether or not there are inflammatory issues going on, such as rheumatoid arthritis. But again, not all bunion deformities need to be treated. It's more so when patients start to get symptoms, then we start looking at treatment options.
And what kind of symptoms are we talking about?
These patients may have pressure from shoes, particularly shoes that are more snug, because you got to keep in mind the foot has widened now. And if you're wearing the same shoes that you wore 4 or 5 years ago, and that's starting to put pressure on that area, that can start to hurt. So we look at that. We look at pain in the joint, if it hurts to move that joint up or down. If there's starting to get some callus formation around the bunion deformity or thick skin that develops from excessive friction or pressure to the skin, that can be a reason to have that foot looked at.
And then in those cases, what are the treatments?
Well, conservative care for bunion deformities, we usually start out looking at the shoes. And I like shoes that have adequate width in the toe box. You want to try to avoid seams that cut across in the toe box where the bunion deformity is.
Mm.
We look at materials that are a little softer, such as a softer leather material or that mesh nylon type of material that we often see in gym shoes.
Mm-hmm.
And another thing that we will consider doing in terms of shoe gear is rotating the shoes during the day so you don't have the same exact pressure points all day. I'm not sure about you, but when I get home, I like to take my work shoes off and put something else on.
I'm not even wearing shoes now.
So some other things that we'll think about are warm soaks. Heat increases blood flow to the area. There's no magic behind it. If it helps, great. If not, you don't need to do it. There are topical products that you can consider, one of which is Voltaren gel. It's a topical non-steroidal anti-inflammatory medication, similar to Motrin or Aleve. So if there's concern about some arthritis in the big toe joint, you can consider using Voltaren gel to try to reduce some of that pain in that joint.
That's over the counter too. You don't need a prescription for that, right?
Correct.
I hate to say this, but on social media, sometimes I get pushed these ads that claim they're going to fix the bunions of the masses. They include things like toe spacers or braces or splints, things like that. Is there any validity to those treatments?
In the time that I've worked here at Mayo Clinic, I have never seen the bunion non-surgically treated so that it goes to the normal position again. So all the things that you see online, I think they can be helpful in terms of cushioning or padding between the toes. But I've never seen any type of product that will shift that first metatarsal back into its normal position and pull the big toe out to its normal position. There are bunion splints that our surgeons may sometimes use to hold that toe in position as it heals. But to actually pull it back into place and realign it and have it stay that way, I haven't seen those products work the way that they may claim to work.
So those products can't reverse bunions, but they might provide a little bit of comfort or relief. Is that what you're saying?
Yep. In fact, I'll sometimes recommend some accommodative pads or cushions between the toes, particularly between the first and second toes. And it may not so much be that you're trying to push the big toe over. It's more so that you're trying to stop the friction and pressure that causes irritation between the toes and even corner callus formation that can develop between the toes. And that can be very painful as well.
When do you decide this is a case where surgery will be a good idea?
Well, we always try conservative care first. And some of the things that we look at is if the shoes are not beneficial, if the topical medications that they've tried are not beneficial, if there's increasing pain or discomfort, if there's redness from rubbing of the shoes, and it seems like it's progressing more and more, and it's affecting their way of life so they can't do the things they want to or need to, then it's reasonable to consider a surgical consultation.
And then what does the surgery entail?
The whole idea behind surgery is to reduce the deformity, reduce any pain associated with the deformity, and increase your function. So it entails realigning that first metatarsal.
Does that mean you're breaking the bones in that metatarsal, or how are you realigning it?
There are actually over 125 different types of bunion procedures, and the procedure that is chosen based on how substantial the deformity is, if there's rotation of the toe in different planes of the foot, the types of symptoms, if there's arthritis in the joint. But in answer to your question, is it surgically broken? Yes.
Wow.
Majority of bunion surgeries, what you need to do is surgically break the bone, slide a portion of the bone over, screw it or pin it or plate it back together, and realign that big toe. That can sometimes be done with tightening some of the soft tissue around it, just so it stays in better alignment.
And what about the neighbor toes?
Well, that's an interesting question, because as that big toe shifts over, it starts to push the second toe out of the way, and you can often see a hammer toe develop in conjunction with the bunion deformity.
What's a hammer toe?
A hammer toe is a deformity in which the toe tends to cock up like it's raising up in the mid part of the toe and then tipping down at the end.
Kind of like if you hook your finger, or
Kind of like hooking your finger.
only it's your toe that's doing that. So does that mean that you sometimes have to then break that hammer toe also?
It depends on how flexible or how stiff the hammer toe is. If it's pretty flexible, sometimes you can do a tendon procedure where you cut a tendon to let that toe straighten out a little bit better. But if it's a rigid hammer toe deformity, you may need to remove a small portion of the bone and run a pin through that toe to hold it straight while it heals.
Wow. Oh my gosh. And there are so many bones and tendons and ligaments in the foot. It seems like this is possibly a surgery that would take a while. Is this something that somebody has to be inpatient for? Is it outpatient?
Most bunion procedures are outpatient.
Really? Wow.
Mm-hmm.
That's amazing that you can just go in and then go home afterward.
Yes, but it can be done.
How has surgical technology advanced over the years? I imagine that the surgeries that are done now are not the same ones that were done 50 years ago.
That's true to an extent. Some of them are tried and true procedures, but there are other types of surgeries being done. One of them is minimally invasive surgery, where very small incisions are made rather than a large incision to open everything up. And the advantage of that is that there's usually less pain involved. Can be a quicker recovery because you're not making a large incision. Now, those types of procedures are good for mild to moderate bunion deformities. But when you get into more substantial or severe bunion deformities, then you may have to have multiple procedures. Now, there are templates that have been developed over the years that can help in getting an exact realignment of those bones and make the cuts so they're much more exact. So technology has come along quite a bit over the years.
Fantastic. And then afterward, what is the recovery like?
Depends on what type of procedure is performed. For example, let's say there's an elderly patient that is very low activity, living in a nursing home, but a painful bunion. You might be able to just shave some of the bump off without having to surgically break the bone.
Oh, okay.
Whereas in a very severe bunion deformity, you may be in a non-weight-bearing cast for up to 6 weeks. And then gradually get back into shoe gear and oftentimes have physical therapy because you've been in a cast for a period of time.
And after all that recovery and so on, the foot is mostly back to normal then?
The toes in better alignment. It still takes time to get those joints moving again. That may be part of the physical therapy, is kind of moving those joints. But the foot is in better alignment and hopefully better fitting in the shoes that you'd get back into.
Ah, fantastic. So the good news is, if a bunion isn't causing you pain or interfering with your mobility and function, it might not need to be treated. However, it is important to make sure you have proper foot alignment, regardless of whether or not a bunion is causing you issues. The first line of defense against bunions is proper shoes, something with a wide toe box. Hot soaks and Voltaren gel can also help relieve pain or discomfort. Devices like toe spacers or cushions can be helpful in reducing friction between the toes, but they can't actually fix a bunion. However, if a bunion continues to progress, causes pain, or interferes with your daily activities, then it might be time to consider surgery. But if you don't have bunions, that doesn't mean you're completely off the hook. You still need to take good care of your feet. Let's hear Dr. Ellman's advice for how to do just that. All right, so let's talk about prevention. Is there a way that we can prevent bunions, or is it just, for some of us, it's written in the cards?
I think there is some degree of control, at least the external factors, meaning shoes, for one. It's important to look at accommodative footwear that will fit well to the shape of your feet. we want to make sure that the shoes are comfortable, usually from day one. It's not one of these things where, they'll break in after I wear it for about 2 months.
And I got to say, I think a lot of women are taught to tough it out for those 2 months, but you're saying we don't have to tough it out for 2 months.
No. And we live in a concrete world where we're walking on hard surfaces all the time. We live in a world where the culture states that we have to dress a certain way. And I think women in general get the short end of the stick on this because these are the high-heeled shoes, the narrow-toed shoes that we need to use or that we want to use. So modification of shoes, reducing the heel height, I think can help. And for the shoes that you do like, have them point stretched in that area of irritation. Take it to a good shoe repair place. Stretch that leather out. Stick with softer leather materials. If there are patients that have this excessive pronation or the feet are rolling out quite a bit, we may consider using inserts or arch supports to try to hold those feet in a better position, and that may help in at least slowing some of the progression.
Where do we get those arch supports from? Sometimes I see them in the drugstore, but is that something we should actually go to our doctors for?
Well, arch supports you can find in just about every pharmacy, drugstore, shoe store, and we don't necessarily suggest that everybody has to have arch supports. In fact, most times, unless there is a specific reason, I don't recommend over-the-counter or custom molded arch supports. For bunion deformities in which a patient has excessively pronated feet, in other words, those feet are just kind of rolling out, that may slow the progression of bunions. But for many of us, it's in the cards. I've got a niece that had juvenile bunion deformities, and they were pretty prominent. So she's had to adjust shoe gear.
And I will say this, over the past few decades, comfortable shoes have gotten a lot less ugly than they used to be.
Well, that's very true.
As somebody who just doesn't want my feet to be uncomfortable, I appreciate it.
Yep.
Now, I'm sure you know, doctor, there are also those folks out there that'll say, just fix all your feet problems by not wearing shoes at all, like people doing the barefoot running thing or wearing those imitation barefoot shoes that are not really quite shoes, but they're like gloves for your feet. What are your thoughts on that?
A couple of thoughts. So you have the minimalist shoes, and then you have the maximalist shoes with the big, thick outer soles and the big rockers on them.
Oh, yeah.
And so I'm not opposed to patients using either of them. I tend to be more in the middle of the road with this. But you have to keep in mind when you are using minimalist shoes or walking barefoot, you are always at higher potential of injuring your foot, stepping on something. It may not give as much support around the foot. Yes, it feels like you're walking more naturally, and some will even say that they feel like they're using their muscles more in their feet because there's very little arch fill, there's very little heel height, there's very little cushioning. But also, particularly with heavier weight patients or patients who are high impact patients, that can tend to put a lot more stressors on the feet. So you need to be careful about that. Whereas the maximalist shoes, yes, there may be better performance and cushioning, but the argument there is, well, then you're not using your muscles as much in your feet, and that's not a good thing. I think you are still using muscles in your feet, maybe not to as great of an extent as when you're walking barefoot, but I tend to be middle of the road between those minimalist and maximalist shoes.
And I also just think, maybe you're emulating cavemen, but cavemen didn't have pavement that they were running on back in the day. I think they were running on dirt and grass and so on.
Right. Our feet take a whole lot more stresses.
Exactly. Now, aside from footwear, are there things that we should be paying attention to when it comes to taking care of our feet? Are there certain things that should be a daily or a weekly practice in terms of foot health?
Well, there are some things I think that are beneficial for general foot care. Number one, we've already talked about rotating the shoes. So you don't have that same type of pressure every day, day in and day out. Replace your shoes on a regular basis.
What do you mean by regular? Because I have an argument with my husband about this all the time. I'm like, I can replace them every 9 months. And he's like, no, you need to replace them more. So what is your take? Are you going to take my husband's side or mine?
I'd be leaning maybe towards your husband's side on this one.
Darn it.
But you have to look at the treads on the bottoms of the shoes, if they're starting to wear out. Or if you can take the shoe and it's bending a whole lot more easily in the forefoot region than when you first bought it, it's probably not giving you as much support. The outer soles of shoes are made of a material called ethyl vinyl acetate, that shock-absorbing outer sole. And sometimes when you see these creases on the sides of the shoes, like on older shoes, that means that material is starting to compress down and it's not giving you that cushioning that you'd like. So I think if you do a lot of walking, replacing shoes on a regular basis might be helpful. Or if you like a certain pair of shoes, buy 2 or 3 pairs of that and wear one each day. They'll last a whole lot longer. Switch them out every other day.
Okay, I like that idea.
Obviously, keeping your feet clean, making sure you dry well between the toes. A lot of people getting out of the showers, they'll just kind of dry the tops and bottoms and slip their socks on, and you're trapping moisture between the toes. And that's a great environment for fungus to develop, like athlete's foot.
Okay.
So keep the feet nice and dry when you put your socks on. Use socks that have wicking properties. There are polyblend socks, and these socks help wick moisture away from the feet, but still keep the feet and socks dry. Whereas cotton socks wick moisture away, and then they just stay damp.
Oh.
So that can help in foot health. If the skin is really dry, moisturize it.
I'm thinking about all sorts of things I haven't thought about before. Are there certain exercises we should do for our feet, or is just walking and so on enough for our foot health?
I guess it depends, again, on circumstances. People who are very active, they're getting a lot of exercise with their feet. That being said, for patients who have had problems with their feet, such as plantar fasciitis or other issues, or if they're just not very active and they want to start getting more active, we might want to work on exercises that may help strengthen what we call the intrinsic musculature of the feet. So you have extrinsic muscles. Those are muscles in the leg that come down into the feet via tendons. And then you have the internal muscles inside the feet. There's 18 muscles on the bottom of and between those metatarsals on the bottom of the foot. And they give all the intricate movements of the toes and stabilize the feet and toes. So there are some exercises that you can do to strengthen some of those muscles, one of which is just simply putting a rag or a dish towel on the ground. Go ahead and see if you can pick it up with your toes. What you're doing is you're starting to fire some of those muscles. And then put it down and then repeat that 5-10 times. And that can help in strengthening some of the muscles. There is something called, interestingly enough, toe yoga.
No, really?
Toe yoga. And this is to work toes individually to start to work those intrinsic muscles. Like, for example, with your foot flat on the ground, you pick your big toe up without picking the other toes up and then set it down. And then you try to pick the lesser toes up without picking the big toe up.
Oh, I'm trying to do it right now while you're talking. I'm like, oh, this is work.
Yep. And then you can spread your toes apart.
Like starfish my toes.
Yes.
Got it.
So those are simple exercises that you can do for your feet. There's another exercise called foot doming. It's where you, without curling your toes or picking the ball of your foot up or taking your heel off the ground, you try to raise the midfoot up.
Oh, that's hard.
Can you feel that tightness?
Yeah.
Somebody's described it as almost like trying to do Kegel exercises for your foot.
Yeah. Oh my gosh. I wasn't even aware of those muscles until the second.
So yeah, you can go online and look at foot doming.
Fantastic. Any other foot health or bunion prevention tips you'd want to add with our final minutes together?
In terms of foot health, if you're going to get involved in exercise, start gradually with it and don't overuse the feet. There are patients say, I'm going to start walking. I'm going to walk every single day. And they start out going full tilt. It's probably not the best thing to do. It may be more helpful starting out walking shorter distance, perhaps walking every other day. And on alternating days, you might want to consider looking at lower impact activities that don't put as much stress on the feet, such as biking or swimming or water aerobics or the elliptical machine. So those are simple types of activities that keep you in shape, but don't overstress the feet.
Well, Dr. Ellman, this has been so fantastic. With your advice, we can all get a big leg up on our foot health. And I feel like I have so much more appreciation for everything my feet do after this conversation, thinking about all the tiny bones and muscles and ligaments that are working so hard to be able to give me my joy every day on my daily walks and so on. So thank you so much, Dr. Ellman.
Well, I appreciate being on your program, and it's been delightful.
If you want to take good care of your feet, shoes play a big role. There's no right answer of whether your shoes should be minimalist or have maximum support, but you should rotate your shoes regularly so they have time to decompress, and replace them if they're not supporting your feet as intended. Also, make sure to keep your feet clean. Dry them thoroughly to prevent fungus. Moisture-wicking socks can help with this. And in general, exercise is great for your feet, as long as you don't overdo it. You can even do specific foot strengthening exercises like toe yoga or foot doming. So whether you have bunions or blemish-free toes, it's never too late to put your best foot forward by taking better care of both of your feet. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us on your podcast app. It really does help others find our show. Thanks for listening, and until next time, take care and stay healthy.